Hello, it's Nurse Amy. Thank you for tuning in. Today I'm going to talk about the certified nursing aide. Who is the certified nursing aide? Well, the certified nursing aide is the first contact. What do I mean by that? Well, the certified nursing aide is the first person that knows most things about you. They're the closest to you in that nursing department. A lot of time, the nursing aide don't feel appreciated, but there's certain things I'm going to share with you that should make you feel good. When a person comes into a facility, after all the vital signs, in some cases, you're the one taking the vital signs. After all said and done, they've been put up in their room or in their bed space. Guess who their next best friend is? It's you. You're the one who helps them to undress. You're the one who helps them to do all the things that they need to do as per daily activities. You're the one who's going to be helping them transfer if they need assistance. You're the one who actually interfaces between them and the nurse most times. You're the one who sometimes interfaces between them and their family members. You are the one who knows their moods. You're the one who knows the changes in their lifestyle. If they're not eating well, if they're vomiting, if they're having diarrhea, if they're having constipation, if for whatever reason they have pain, they're not able to move their limbs, they're coughing, they have chest pain, guess what? It all starts with you. If they've been abused, it is you. It's always you. You're the one who's there with them at the end of the day and first thing in the morning. You become the resident's best friend, so you should take your job very seriously. Now, a certified nursing aide, things that you need to know, if you don't know anything else, is activities of daily living. And like I tell my students, if you don't know what activities of daily living are, well, just think about the things that you need to be doing every day. Things that you need to do every day. Do you brush your teeth? That's part of activities of daily living. Do you comb your hair? That's part of activities of daily living. Do you use the bathroom? Either bladder or bowel? Well, guess what? That's also part of activities of daily living. Do you watch TV? That's part of it. Do you speak to people? That's part of it. Now, some of you might want to speak. Well, yeah. Sometimes your residents want to make a phone call. Guess what? You have to make that happen. And sometimes you're the one who's actually helping them talk to the person on the other line or on the other side of the line. You are very important. Activities of daily living. For those who use wheelchair, you will be helping them transfer. They need to make doctor's appointments. Sometimes you are needed to go with them. You go with their chart, you go with their information, and you help them even talk to the doctors. Do you see how important your job is? A lot of certified nursing assistants don't feel appreciated. Don't take it personal. It's nursing. We're used to it. Welcome to the club. We don't feel appreciated. Now, mind you, there are those family members. There are those interdisciplinary team members who would appreciate you. They're few and far between, but when they come, they're well received and well appreciated. But like I tell people, when you're going to be doing this job, it's not so much for immediate gratification. It's a calling. I had one of my colleagues, actually she was a student of mine and she became a colleague. She said it's a mission. I believe that too. You've got to know why you're doing this. It's not easy. So, having said that, please, certified nursing assistant, you need to know your place. If you look at some of my videos, I have said, and I'm saying it again, The certified nursing assistants are the bedrock of healthcare. Why am I saying that? Well, you're the first people to notice changes. Again, if you know the activities of daily living and something is off, something is different, something is changed, you will be the first to know. You will be the first to know that this person is always choking, always coughing every time they're trying to swallow. You will be the first to know that, you know what, it's been probably 3 days since this person had a bowel movement. You will be the first to know that this person, for some reason, is sleeping more than usual or not sleeping at all. You will be the first to know that someone is losing weight. You will be the first to know someone has changed. They've become very combative. Is it possible that maybe they have a UTI? You are the first person to know when a family is abusing a resident. You will be the first to know of different types of abuses that sometimes, unfortunately, happen to some of our residents. There's so many things you are so privy to. Plenty things. And that's why your position is very important. You've got to operate within your scope of practice with dignity, honesty, loyalty, professional. You've got to be professional. Your residents are not your friends. So every time, no matter how many or how much stories they tell you, you're not supposed to be sharing yours. Well, there are exceptions. There are times when you share your story just because it might help that person better understand a situation. But you've got to be careful. There's a fine line there. Always be professional. Always know that the care plans and the treatment plans and the doctor's visits and even to the social worker, it's usually the information you get because you're the first-hand person to get it. It's what trickles back down. And then when you have a treatment plan, you have a care plan, a care conference, you have, someone has to visit the doctor for evaluation. It's because of reports that you've given to your nurse. The certified nursing assistant is very important. Be proud. Thank you for tuning in. Remember to subscribe if you're new here. And if you're one of my old-timers, thank you for all your support. I appreciate you. I love you. Till I come your way again, be safe, be kind, be blessed.